What medication do people with ADHD take and do they work? I'm a clinical psychologist who does online ADHD assessments. You can take our free quiz to see if you identify with the symptoms of ADHD, but it's not an assessment. But I'm going to tell you exactly what medication does and how it can help people. So medication fall into essentially 3 different classes. You've got stimulants, which are your first line of medication. What stimulants do is they stimulate the frontal lobe, which is like, woo, it's got 100 tabs open in ADHD. It says shh, it stimulates it, it quietens the frontal lobe so you can focus on one thing at a time without all the noise going on. Now, if you have a history of drug or alcohol addiction, it's unlikely that a psychiatrist is going to prescribe you stimulants, so they might prescribe non-stimulants. Now, this can include SNRIs, which are selective norepinephrine reuptake inhibitors. With ADHD, you have lower levels of access to dopamine and norepinephrine. These are important neurotransmitters. Norepinephrine helps you get started on tasks. So whilst the non-stimulants might take a little bit longer to kick in, they work on your norepinephrine and they work in the same way as stimulants, just not as rapidly as a stimulant might work, but they still can be very effective. And then you've got other medications such as SSRIs or other outliers. But it's really important to get a proper assessment, speak to a psychiatrist about medication. This is not medical advice, but if you've got a question on psychology, let me know in the comments. I'm a clinical psychologist. Follow for more.